Hi, thanks for joining me for another video blog. Before we get started, I'd just like to say a big thank you to the Herbal Extract Company. Every 6 months or so I have a visit from the Herbal Extract Company rep where they update me on all the latest research and so forth regarding their herbal products and how they may be beneficial for a particular pathology. At this time, we're going to talk about long COVID. Okay, so you've probably heard about that, and that seems to be something that is occurring with people that have contracted COVID-19 and just can't seem to recover. And you'll see here by definition, it's a chronic outcome of SARS-CoV-2 infection that was caused by COVID-19. So if we just look at it briefly as an introductory purposes, roughly 1 in 5 people are having lasting symptoms. In other words, they're not properly recovering. They're ending up with some sort of fatigue or shortness of breath or even some level of cognitive dysfunction. And, these symptoms may persist past a usual, what we would regard from a naturopathic point of view, 2 to 4 weeks of a convalescence period of recovery. And these people are being referred to as, or they're referring to themselves as long haulers, not too different to people that travel or flight attendants that work internationally. So remember, initially with COVID-19, most of us, or if not majority of the public, was concerned with the fatality rate. And let's face it, the media certainly made us well aware of that, publishing data every day with who was getting sick, the hospital admissions, the positive PCR tests, and also the mortality rate. And that presented, let's just say, a significant fear amongst the population. However, later, the concern, particularly for practitioners, became around, the psychological and the social outcomes that were highlighted as a result of the long-standing illness. So they like to call long COVID the pandemic after the pandemic. And, it was first used or first coined by Alyssa Perigo from the Institute of Archaeology at University College in London as a Twitter hashtag, believe it or not. At least now that Elon Musk has bought Twitter and there's no more censorship, someone like her may have free to speak freely again. Other terms for long COVID are post-acute sequelae of SARS-CoV-2, PASC for short, post-COVID-19, post-acute COVID-19 syndrome, etc. So there's a few different names. So if you happen to go to a doctor, don't be surprised if you labelled as something along those lines. The WHO has a definition for post-COVID, and you can actually just Google that. I've left a link here, so click on that and have a read. The definition may change as new research comes forward. However, at this stage, it's sort of been suggested that the definition is too vague, and it may be some sort of psychosomatic illness with a severe post-viral organ dysfunction. And what they're discovering so far is their recovery time is unique to an individual. So if you don't know someone already who's actually suffering from this long-haul situation post-COVID-19, then perhaps you'll meet someone soon and you find out about how long they've had it. There are a few odd things that occur as long haulers. Some of them actually never got sick. They just have these very sort of oblique, somewhat vague symptoms. Some of them, however, suffer damage to their immune systems with ongoing inflammation. Okay, and others have very specific symptoms such as chronic lung or organ damage. They might have muscle weakness or cognitive brain dysfunction. Some suffer as a result of post-intensive care unit syndrome or post-traumatic stress disorder-like syndrome. They've discovered that it's difficult to identify as it's very similar to other diseases, and I'll talk about them in a moment. It's difficult to predict the duration of the infection. So, don't be alarmed if you're one of those people that can't quite put their finger on what's going on. However, if you're one of them, you probably notice that it's affecting your ability to perform your daily activities. That seems to be common. This may result in a sense of helplessness, so there seems to be a need to somehow manage those symptoms. And there's data coming out now that suggests there's some sort of stigma when you have this level of diagnosis and you have difficulty accessing services, relationship difficulties, and there's a barrier to engaging in activities. So if this is you, don't be concerned. This is what's happening out there or in the community. So what is this particular situation or this illness, and how does it come about, and what does it do? How does it infect? Okay, so we have this receptor in our body called ACE2. Okay, it does many things in the body, all right? Many things. Most of us as practitioners used to know it as a receptor that had a relation to blood pressure, particularly in relation to kidney function. But now we start to find out that it's much more prevalent throughout the body. Okay, and you're probably hearing that many people are experiencing many different side effects, and that's because this particular receptor is all over the body. So it can lead to inflammation, it can lead to vasoconstriction, which means narrowing of your blood vessels, and it can also cause thrombosis. Now, we all know about thrombosis from deep vein thrombosis, particularly with air travel or sitting stationary for long periods of time. For this to actually become active, it requires a spike protein to actually enter the cell. All right, so the ACE2 and the enzyme it can be located in the gut, the lung, the heart, the liver, the kidney, and immune cells, like I said, all over the body. So it's postulated that long COVID symptoms are strongly associated with the loss of this particular enzyme's activity. Okay, so it seems to be associated with energy metabolism, so that relates to you've probably heard of your, God, the name escapes me right now, the mitochondria, the little energy producing parts or organelles of every cell, some dysfunction within them, okay, leading to cardiac problems, pneumonia, blood clots, kidney failure, strokes, brain fog, excess inflammation, and in worst case scenario, autoimmune disease. Also has been associated with gut dysbiosis. So gut dysbiosis is a condition where the membrane that separates the gut from the bloodstream becomes dysfunctional, and small proteins that haven't been broken down properly can actually find their way into the gut, from the gut into the bloodstream, where the immune system actually goes on high alert and there's an immune response. And yes, we don't want that. That's what gut dysbiosis is. So they're starting to get an idea about what the persistent symptoms are. Okay, so in the annals of internal medicine, they're not really discovering any evidence of the virus persisting or hiding out in the body in some way, shape or form. And there's no evidence of overactivity or malfunction of the immune system, so to speak. All right, so they're a little bit confused as to what's actually going on here. There is one thing, however, the experts do seem to agree on the results of from a variety of disease-causing mechanisms, none of which are mutually exclusive. Okay, so this is presenting quite a conundrum for the medical research community. What they do seem to agree on is some level of viral persistence. Okay, and that perhaps there's some inactivated viral fragments floating around the body, which can lead to or have a reactivation of a latent virus. This means if you've had the virus and perhaps you've got over it, perhaps you're not out of the woods and you can actually have the virus again at some stage. So this is not a conclusive statement, however, and it seems to have something to do with what happens with the immune system, and you'll see here it can be a state that's triggered by pro-inflammatory cytokines. Don't get carried away by the technical talk here. Cytokines are basically immune system messengers, okay, that somehow lose their order, so to speak, and create problems throughout the body. All right, continuing on, there can be maybe some sort of autoimmune response, perhaps tissue injury, hyperinflammation. In other words, the mast cells, which are an aspect of your immune system function, become overactivated. Okay, so the inflammatory system gets involved in that. They've also researchers also suggested that there seems to be a recurrence of other pathogens in the body. So let's say you had Epstein-Barr virus or chickenpox or HV6. There are some people that are having these sorts of viruses reactivated, okay, or in addition to unresolved pneumonia. As I mentioned before, it seems to be similar to other pathologies such as Ross River fever, dengue fever, Epstein-Barr virus, influenza, and even Ebola and perhaps Lyme's disease. So this is where the medical system's having trouble trying to figure out what's actually going on here, because some of the symptoms look very similar to some of these other pathologies, right? There seems to be, and what they like to call it is a clinical feature overlap, particularly with myalgic encephalomyelitis or chronic fatigue syndrome. So there is a diagnostic criteria that they have for chronic fatigue, and when someone reports symptoms of long-haul COVID, it seems to have some sort of overlap with CFS. Okay, so there's problems with mitochondrial dysfunction, as we mentioned before, brain fog, and even muscle pain. It seems to be has a non-specific nature and lacks some level of objective diagnostic finding. In other words, there's no specific test that you can go to your doctor for and they go, oh yes, you've definitely got long COVID. It just doesn't work that way. It seems to be like, let's look at a range of things, like what are you presenting with symptomatically, what are you presenting with from a sign point of view, in other words, what can be measured in the body, and what are you presenting from a pathology point of view. Okay, so we're trying to put all this together. All right, let's talk about some of the long COVID symptoms. Okay, so we've got breathing difficulties, okay, persistent cough, maybe a sore throat, trouble speaking, or you can hear my voice. Well, I did experience COVID during the pandemic. It lasted 4 days. By the way, I'm unvaccinated, and left me with nothing, effectively. My voice, as it is at the moment, is part of a more chronic problem, believe it or not, from 30 years ago. There can be cardiovascular issues such as myocarditis, pericarditis, and in a severe situation, maybe heart attack. All right. There can be hormonal or endocrine dysregulation, particularly in diabetics where there's deterioration in diabetic control. Osteoporosis may come about from prolonged immobilization. And then we get into the cognitive decline. We get mental health issues such as confusion, forgetfulness, lack of clarity, etc. So a number of different symptoms. And here's some further ones. We've got neurological issues. We've got cardiovascular issues, in addition to hematological issues such as anemia or blood clots. Okay. Musculoskeletal problems, dermatological problems, in other words, skin rashes and hair shedding. And then we've just got symptoms in general, such as weight loss, low-grade fever, gastrointestinal tract upsets, such as upset tummy and digestion, and pressure sores. What are the risk factors? There doesn't seem to be any initial relationship between the initial severity of COVID-19 itself, in other words, your illness, and the likelihood of developing long COVID. However, there is some sort of evidence that suggests that if you're a woman, it disproportionately affects you. Okay, particularly there seems to be an overlap with perimenopause and menopause. They seem to suggest that it gets worse with age, so if you're older, you're more likely to have long COVID. And if you've got Epstein-Barr virus or you've had it, COVID seems to induce it. All right. The vagus nerve, which is one of our big, largely unstudied nerves, it seems to suffer from a bit of dysfunction, and as a result we end up with heart rate issues, speech, gag reflex, sweating and digestive issues. What about other risk factors such as cancer or chemotherapy, cardiovascular disease, chronic lung disease, chronic liver disease, etc. So these perhaps are known as comorbidities, things that you perhaps are suffering with before you get COVID. Maybe they make the likelihood of you actually experiencing long COVID much more likely. Okay, so there seems to be some observational data in relation to Down syndrome, dementia, obesity, sickle cell anemia. All right, now, this is a presentation, or this sort of documentation is for practitioners, but it just doesn't hurt to know that if you actually have any of these, there's a good chance that if you've got long COVID or you've had it, you've had COVID and you're having trouble getting over it, and you've got one of these other syndromes going on, then there's a likelihood that you may have a little bit of difficulty moving forward. There's also a gut relationship, like we mentioned before, with dysbiosis, and there's a very small relationship to vaccination, approximately 15%, causing this as well. All right, how do we diagnose this long COVID? Well, it's a diagnosis of exclusion. Okay, so that basically means we try and look at everything else before we actually come back and we look at this. All right, so it's a minimum in terms of the time or the duration. It's 3 months after infection. So that rules out normal recovery, right? So usually there's like a positive PCR and or COVID-19 signs and symptoms up to 4 weeks long, and then an ongoing symptomatic picture of 4 weeks to 12 weeks. Okay, so then the long COVID is anything after 12 weeks and is not explained by what we call alternative diagnosis, such as clusters of symptoms overlapping which fluctuate and change over time and affect anybody's system. So nothing that they can really nail down. So let's just begin to look at conventional treatment and prevention. Okay, so this seems to require long COVID seems to require a multidisciplinary approach. Okay, so not just one approach. All right. So what they do know from the research so far is that there's no specific medication that seems to help you with this, because there's no clear biomarkers that you would use in a conventional diagnosis. And the current data suggests that there's holistic care is beneficial. Okay, so it could be helpful to seek out a number of different practitioners and look at yourself from a holistic point of view. There are centres that have opened up in the major cities, and there are outpatient clinics floating around. So just take a look, and you'll find if you're suffering from long COVID, there is help. Just got to start taking a look. Okay, what have we got here? Natural therapies and prevention. Okay, so it'd be much better not to get COVID, right, or at least minimise our chance of contracting COVID and minimise our chances further by doing something from a preventative point of view from getting long COVID. Okay, so an ounce of prevention is worth a pound of cure. Okay, so you've probably heard that before. There's no magic bullet, and it's all about managing individual symptoms. Pardon me. So the key here really is to strengthen the immune system by maintaining a healthy living and healthy lifestyle. Long COVID is a complex scenario, as we've discussed so far, And, treating it gives us a chance to really look at what else is going on, such as the comorbidities like, say, diabetes or cardiovascular disease, etc. And what we do know is that we're going to take a similar approach to checking out things like chronic fatigue syndrome or chronic Lyme disease. So, I practice as a naturopath. What are the things we're going to be looking at? Okay, so we want to be looking at, convalescence. How do we just allow ourselves to take care of ourselves in a convalescing type period? Okay, where we're going to maximize our self-care with doing things as, looking at our sleep, looking at the relaxation we do, getting out in the sunshine, a little bit of gentle exercise, fresh air and nutrition. So what they've looked at so far, and you'll see here quoted by Simon Mills, who is a herbalist, that he says the neglect of convalescence may prove to be one of the most serious mistakes in modern medicine. Well, that's not untrue, that's for sure. So an individual with long COVID requires an individual treatment plan. I mean, that's the case with any presentation to a naturopath, okay? We don't just go, oh, you've been diagnosed with this, so therefore you're going to have this, this, and this herbal array of supplements, or any supplement for that matter. We look at the whole picture, okay, just like what we discussed on the previous page. So it's a unique protocol, and we want to identify the specific symptoms, so we look at that from a systematic point of view. We also look at diet, lifestyle, and exercise. Dysbiosis is very much important when you go to a naturopath. We want to look at how your gut's functioning. So we want to look at, what's happening in your bacterial balance down there, particularly in your small and large intestine. And we want to get that sorted. So we're going to probably focus our strategy a little bit more, where we're going to be looking at a consumption of, clean and healthy food, okay? And we're going to supplement with herbs and other supplements if required in a very targeted approach. Our treatment goals are going to be probably to look at dysbiosis, inflammation, and here's a whole list here accordingly. And we've got a little bit of dietary intervention, okay? We're not going to remove everything straight away because your body would go into shock, okay? That would be silly. But we do want to start to look at removing foods that are going to upregulate or have an effect on inflammation in the body, okay? Particularly things like excess dietary fats, particularly trans fatty acids such as, baked goods and, eating too many pizzas and croissants and that sort of stuff, okay? Or McDonald's, let's say, and particularly excess sugar and alcohol. We're going to try and add a whole lot more fresh fruits and veggies. And surprise, surprise, the Mediterranean diet comes through again. We've always talked about this. I've been doing naturopathy for over 20 years, and the Mediterranean diet always seems to be mentioned in some way, shape, or form. So we also want to make sure there's adequate protein. We want to make sure there's a good source of good fats coming in, like say from oily fish, nuts, and chia seeds. And then we want to look at, bacteria type foods, like leeks, onions, garlics, asparagus, etc. We want to sort of get some plant foods coming in, okay? So they create what's called a greater alpha diversity, which means they're more healthy for us. Get some probiotics in there and look at our baseline nutrients, okay? Zinc, selenium, quercetin. Quercetin was talked about a lot during COVID. It's effectively the gun that loads the zinc bullet that gets the zinc into the cell, okay, and upregulates our immune system. And we also want to look at phytonutrients, okay, so this can be done in many ways. We want to make sure that we drink plenty of water. Now, if we're lucky enough to have a filtration system in our house, yes, that would be great. If you haven't got one, it would also be great to have that as an asset in your house, okay, so if you can afford it, by all means. We want to look at the psychology, okay, like a mindfulness plan, such as counseling, yoga, meditation, etc. Remember we talked about cognitive decline? This is where the mindfulness plan comes in, okay? we also want to look at sleep hygiene. Okay, so sleep hygiene, if you haven't heard that term before, that relates to, what do we do as we're getting ready for bed? How do we spend that hour prior to us going to sleep? Do we have some sort of sleep regularity with regards to when we go to bed? How do we fall asleep? How long does it take us to go to sleep? Do we wake up during the night? What do we do during those times? All that sort of stuff. Okay. We also want to be careful with our exercise or return to exercise. There's some other things we can do. We can look at acupuncture. Okay, so that looks at balancing energetic meridians. We want to remove a toxic load. We can do steam inhalations if the long COVID has really affected us hard in our lungs. But one of the main things is we all want to maintain social contact, okay? Now the big problem with COVID is that we lost our connection with other humans, okay? Now we know from the research that creates all sorts of problems, okay? So get back out there and say hello to people at the coffee shop, all right? Now, I'm a big fan of kinesiology because this is like a biofeedback hack that allows us to get in there and identify issues with greater specificity rather than just guessing like we would have done before, like as a conventional naturopath. So what do we got to say about this in the end of the day? At this stage, after going through 2, 3, 4 waves of COVID, we've got a challenge at our fingertips right here and now, okay? And we're going to be challenged for some time to come. The likelihood of the definition of long COVID is likely to change. And however, we do have a series of persistent symptoms that continue to drive this pathology. Okay, so there's no clear answers. And it's going to be continued to be studied. So what have we really learned from all this, okay? It's really the lesson from this pandemic is that it's been neglected by conventional medicine. It gives alternative practitioners such as myself or complementary therapists a big chance to get our foot in the door and really help people. So if you've been a little bit hesitant or reluctant to seek help outside the conventional medical system, now might be the time to take that leap and have a go, right? Can't hurt anyway. So in conclusion, this is just a little bit of text from a book called Functional Herbal Therapy, where it says, COVID-19 pandemic demonstrates we have a piecemeal system of disease care. In other words, we have lots of specialists, but no one looking at the big picture. And that's really how our health system has worked for many, many years. Okay, so it's left us being exposed to being vulnerable to a novel or infectious threat, such as COVID-19, where we struggle to find ways out of a conundrum that still cling to this idea that there's a magic pill or a magic bullet. Okay, COVID-19 forces us to confront the most brutally honest and vitally important question, and that is that we are, on whole, a sick species with overall resilience and immune systems that are badly compromised by our modern way of life. Okay, I'll repeat that again. Our immune systems are badly compromised by our modern way of living. All right. It also reveals that governments are prepared to spend trillions of dollars on social, economic and medical remediation on the impact of the virus, but after the fact, it's just too late. Okay. It demonstrates the inherent complacency and the short-sightedness of a system of healthcare that pays only token to disease prevention and improving community health, and will no doubt continue to do so despite a now glaring, ultimately costly deficiencies in this approach. So I just put it up there because I happen to strongly agree with this. Okay, so let me be clear, this is not the Herbal Extracts Company approach. This is just something that is available in a book that I happen to agree with, and I think it really sums up the situation today. So I hope this has been a helpful presentation for you, and if you've got any questions, by all means contact me through the website at naturallypowered.com.au, and I look forward to having a chat. By the way, you can have a 40-minute free consultation, and I'll be more than happy to chat to you about your problems or your health issues. Until then, stay well.